Greetings, listeners and learners. Welcome to our 5th episode of Healthcare Headlines, a podcast summarizing the recent major healthcare news and what you need to know. I'm Dan Grauman, Managing Director and CEO of Verilon, a management consulting firm that helps clients with their most challenging issues in strategy, finance, M&A, physician alignment, and compensation. We also offer our virtual board education solution, which is a tech-enabled, video-based governance education service for board trustees. This podcast will live on our virtual board education platform and wherever you get your podcast. So let's jump right in. First up, we're going to talk about artificial intelligence advancements in clinical applications. The healthcare services industry is rapidly adopting artificial intelligence, or AI, to increase patient access to care and to assist clinicians with documentation. Hackensack Meridian Health and K-Health are launching a 24/7 virtual primary care service that harnesses AI to enhance patient access to healthcare. This solution aims to address the issue of primary care physician shortages across the nation. Through artificial intelligence, virtual primary care can alleviate the burden of patient visits by on-the-ground physicians. In this particular case, K-Health will utilize an artificial intelligence chatbot for automated intake and data entry before virtual clinicians encounter a patient. This information will integrate into Hackensack Meridian Health's EHR. On a related topic, Becker's reports that Advocate Health is testing virtual nursing initiatives. These programs aim to alleviate the provider burden and improve the patient experience. They include 24/7 virtual monitoring of inpatient beds by virtual nurses, a central location of virtual nurses that meet hospital-specific needs, and nurses rotating between in-person and virtual care. According to Advocate, the programs are beginning to achieve the following outcomes: improved nurse retention, better patient engagement, nurse-to-nurse engagement, and length of stay throughput. Next up, we will discuss the status of the Telehealth Modernization Act of 2024. So far, the House approved the act, and it would retain the Medicare Hospital at Home program for an additional 5 years, and would also allow broader use of telehealth under Medicare. The funding for these programs would come from proposed savings on Medicare prescription drug cost. These savings would be realized by prohibiting pharmacy benefit managers from tying their compensation to drug prices. Hospital at Home programs allow patients to receive care in the comfort of their own homes, freeing up hospital beds for higher acuity patients that require their care to be managed in a traditional hospital setting. These programs benefit patients by enhancing their comfort and reducing the risk of hospital-acquired infections, while simultaneously helping hospitals by freeing up beds and reducing cost of care for patients receiving care at home. Next up is an update on VillageMD. Despite prior scalebacks in primary care, it's now opening multispecialty hubs in New Jersey. More specifically, in New Jersey, Summit Health, which is owned by VillageMD, is expanding its presence through opening multiple new facilities that will host a range of specialties, including gastroenterology, orthopedics, and surgical services. This expansion is part of VillageMD's strategy to enhance multi-specialty care following their acquisition of Summit and CityMD earlier this year. Meanwhile, VillageMD has recently scaled back its investment in primary care clinics, leading to the closure of several locations. Now, let's explore the topic of scope of practice considerations for advanced practice providers, or APPs, to understand the arguments for and against widening their roles in clinical care. APPs, as you may be aware, include physician assistants and nurse practitioners. Advocates suggest that expanding APP's scope of practice could alleviate the physician shortage and reduce rising healthcare costs. However, recent trends indicate that compensation for APPs is on the rise, with the average starting salary for nurse practitioners increasing nearly 9% from 2023 to 2024. Finally, in our last podcast, we reported on the closure of rural obstetrics units. These rural obstetric unit closures continue to occur, which will impact maternal health across the nation. According to the Center for Healthcare Quality and Payment Reform, more than 100 rural hospitals across the U.S. have stopped delivering babies over the last 5 years. Furthermore, 39% of rural hospitals with OB services are experiencing losses on all patient services. In the midst of these closures and negative financial margins, a bill was recently introduced in the Senate that would boost Medicaid reimbursement to rural and safety net hospitals for maternity care services. The Keep Obstetrics Local Act would raise Medicaid payments for maternity care at rural and safety net hospitals to up to 150% of the Medicare rate, helping to sustain labor and delivery services in rural and underserved communities. So that covers the major headlines for this past month. The one constant we can count on in healthcare is change, so tune in next month for new developments in episode 6 of Healthcare Headlines.